Innovation is really important because we can't carry on doing things the same old way, day in, day out. The NHS is changing, the people we serve, their needs and expectations are changing, the economy is changing, and alongside that there are all sorts of new technologies appearing. We just need to be able to identify the right ones that will give us the best return for the public's investment and will be the most safe and effective for our patients.
I think it's hugely important for healthcare, not just in terms of improving patient safety, but also innovation is one way of being able to meet the ever tighter budgets within the NHS, and seeing how innovation can reduce costs and improve safety at the same time, for me, is one of the reasons why we're in the business that we are.
It's a really good opportunity for me to get to hear about innovations, collaborative and safety initiatives that are going on around the region, which is very relevant in my job as Head of Patient Safety and Quality.
I'm a nurse, I've worked in healthcare all my life, so I'm always looking for people in other types of industries, if you like, to kind of work together for new ideas and how we can change things for the future for patients, really.
We're entering a time where no single group of people can solve one problem, and what the AHSNs, I think, offer is that they bring people with different interests, different expertise, different knowledge and different approaches all around the same table. So you have academics, providers, commissioners, people from social care, people from local government, and particularly important, people from industry.
Well, I see the network as a very important conduit. Unfortunately still, there are barriers in the NHS and the industry which perhaps keep us separated at times. So I see the network as a great vehicle for being able to break down some of those barriers, allowing us to engage in a dialogue which all comes to one point, because that's why we're in existence, and that's patient benefits and outcomes, really.
We've been working with the AHSN for the last 12 months. And it's been absolutely instrumental in getting us into the right places. Networking, it's all about spreading adoption. The network helps us in two ways. It opens doors, it reinforces some of the ideas that we already have, but it's this spreading adoption, it accelerates innovation, and it's accelerating the adoption of our technology into the NHS.
The AHSN has been a really fantastic partner in a lot of the research and thought that's gone into some of the programmes and innovations we've considered as a CCG.
When we developed the maps for the AHSNs and decided what their boundaries should be, they're mapped on patient flows. So what we have within AHSNs is a kind of discrete healthcare economy that I think is of manageable size, where people can innovate in a meaningful way.
I think we've heard today so many really interesting stories about innovation and how it fits into changing the way we design services, changing the way we provide services, and all the speakers kind of referred in their various ways to that. I think Bruce Keogh was really clear that the demands that are going to be on the health service and the requirements for providing care for patients means we have to do things differently. We have to innovate, we have to be efficient, but we need to be creative in the way that we do that.
I think the AHSNs are going to be the engine for innovation in the NHS.